Karen Safranek is a survivor. 13 years ago, she was diagnosed with breast cancer, but after intensive chemotherapy treatment, was declared cancer-free. It was good news, but while the cancer was gone, the treatment had triggered a severe case of peripheral neuropathy, a debilitating condition that causes chronic pain.
Well, on a scale of 1 to 10, it was like a 12. It was excruciating pain. Like my feet, my legs were on fire. But it's so hard to describe because they felt so painful, yet they were numb.
And it's a condition that won't go away. Dr. Charles Loprinzi of the Mayo Clinic says peripheral neuropathy occurs when the brain sends pain signals to damaged nerves in a constant cycle. He says it's a common side effect of chemotherapy that's difficult to treat.
It's a major problem from a number of chemotherapy drugs, probably the most prominent problem that we have these days. For some, it limits how much chemotherapy we can give. For some that get the chemotherapy, it gets better afterwards, but for some, it stays there and is persistent, can be a persistent problem for years.
That was the case for Karen Safranek. For her, the pain was so severe she could barely walk. But then she learned of a clinical trial at the Mayo Clinic that was testing a new device called the Scrambler, and she signed on without hesitation. The machine, which resembles a large car battery, is designed to break the pain cycle.
You put electrodes on those nerves and you give them different electrical signals. And those different electrical signals kind of retrain the brain and say, really, this isn't pain.
After her first treatment, Karen says Scrambler therapy started working. After 4 treatments, the pain she had endured for more than a decade was gone.
It was so incredible that I hadn't felt pain-free for so many years that I guess I didn't expect it to last.
It's been a year since her Scrambler therapy, and Karen says the pain has not returned. Dr. Loprinzi says the Scrambler will not work for everyone, and that broader testing needs to be done. But eventually, he says, it could be the key for many people like Karen Safranek to live a life free of pain.